Thank you, Faisal. I may be the elder, but I am also the small carrot, or a representative of the Small Carrot Society. I'd like to thank firstly Barlow World and Isaac Shongwe for hosting us this morning, and Percy Mshlati for the initiative of starting this series of debates, and for inviting me to be a member of this panel and to be a part of the panel with the Minister of Health, the Honourable Dr. Ara Matsaledi. We've been asked to express our views on whether there should be a common agenda for healthcare in South Africa, and what the elements of that agenda should be, and how that agenda should be constructed. I'd like to start by stating that these are my personal views and not necessarily the views of the organisation that I represent, and I'm speaking specifically about the South African Private Practitioners Forum. The SAPPF is a relatively new organisation. For those that do not know us, we were started in 2008. We have about 2,700 members who are all specialists in private practice. I'd like to start by saying that we absolutely support the concept of universal access to healthcare, and we would like to participate in that process. South Africa is a hugely unequal society, and any agenda that seeks to work towards the universal access of quality healthcare must bear that factor in mind. We have huge numbers of unemployed. Poverty is an extreme situation in this country, and we have a very small or relatively small tax base with which to try and deal with these problems. The South African Private Practitioners Forum unequivocally supports the need for reform, and we believe that a common strategic agenda for healthcare is possible, but it must be pragmatic and it needs to be affordable. It should be carefully considered and empirically researched prior to implementation. Reforms should therefore be instituted only if they are practically implementable and affordable. It is clear that rehabilitation of the public service is the primary task that we face. But I think it's crucial to understand the role that the private sector can play in this rehabilitation. And this should not be ignored nor underestimated. What I'm going to say now will express certain disagreements with the route proposed by the government, but I'd like to say at the outset that these are not personal. I have nothing personal about the Minister, who I respect enormously. I admire his enthusiasm and his integrity. But the government has made it clear through the Green Paper on NHI what I believe its concept of a common agenda for healthcare should be. And we have expressed, as the SAPPF, our concerns about some of the issues that have been raised in that document. Now, there isn't the time, or this is not the place either, to actually discuss those concerns of ours in detail, but we have included them in our submission on the Green Paper, which the Department of Health has received. Suffice to say that we believe that NHI is the wrong cure for a misdiagnosed problem. And it's also an example of what can happen when political considerations take precedence over the economic realities in which we find ourselves. I believe that in developing a common strategy for health, we need to put ideological issues aside and concentrate on the pragmatic and proven issues that can deliver the sort of healthcare service that this country desperately needs. NHI, and I'm not referring to the 10-point plan at the moment, but NHI is a financing mechanism only. And we know that we can do better with the money that is allocated to the public health service. Rather, it's the organisation, management, and the leadership challenges in the public sector that need to be addressed. We do not need the complexity, nor can we afford the cost of the envisaged NHI system. SAPIF does also not accept the premise of the Green Paper that it is the existence of the two-tier system of healthcare in South Africa that is the cause of the problems in the public service. Nor do we believe that pricing of the private sector is out of control, or that the private sector is a monster that needs reining in, which is how we have been described recently in the press. The reality, rather, is that the private sector is a South African asset. It's a fact attested to by the many thousands of people who visit this country for health care. In the opinion of a headline in the Star dated the 15th of March this year, it stated that private healthcare in South Africa is medicine that is as good as it gets. That is not to say that we don't recognise the need for reform in the private sector. We do. But it's a fact that private healthcare generally delivers healthcare of a very high quality and at affordable prices for those who can afford it. When I say that, I'm talking internationally. I mean, it may not be affordable to a lot of South Africans, but in the world context, private healthcare in South Africa is actually very affordable. So, the Centre for Development and Enterprise stated in their submission on the Green Paper that reform of the private sector would be an important step forward on the long road of tackling the establishment of accessible healthcare, quality healthcare for all in South Africans. It would not be a backward step. So we believe that two systems, public and private, working together in unison under one caring ministry, is a common agenda that we could support. And we urge that the role of the private sector to be considered very seriously in this. We have a very distinct role to play. If I can turn very briefly just to the, it looks like I've run out of time. But if I could just say that our current and potential contribution to future health of our nation should not be underestimated, belittled, or undermined.